everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. Am I audible and visible, everyone? All right, that's great. So yes, I see Dr. Kundan also here because I remember your name from the KBMD. You were there on the top in the leaderboard. Chalo, let's start. Whenever I'm late, it's not that you have to just keep waiting for the class to start. You have to utilize that time for revision. That is a blessing in disguise. Basically, I'm giving you extra minutes, extra time to revise. In those 5 minutes, 10 minutes, revise the MCQs, do revision of whatever you have done read in the entire day. Okay. Yes. So let's start with the Biochemistry Mega Revision Part 2, and I've shared the PDF which has the yesterday's notes also. Like, this is a PDF that I've already shared, and what else do we have today in discussion are the rest of the topics. The PDF has been shared on the Telegram group already. Okay. And a quick update, the majority of you know this already. So we have 20% off till February 28 on the medical PG subscriptions. We have the FMG course, and we have the next course that is running 6 months FMG course at around 15K. The next Wala course 9 months duration at around 17K. You have the code Dr. Nikita for getting the discount. Right. And what else do we have is in the Aspire next batch, it's a 9 months course where we are starting this on February 28, and you have the best of the educators basically to cater to your needs. For the students appearing for NEET PG 5th March wala, you have the final booster batch running on the platform, which has the PYQs, the most expected MCQs, and the BTR as well. ठीक है? So let's start with this one. Amino acids हो चुका है, ये सब हम कर चुके हैं. Today we would be having a lot of focus on the enzymes, the vitamins. Right, so this is the last one that we had seen yesterday. That was hormone sensitive lipase, hormone sensitive versus lipoprotein lipase. Now, starting with the sites of metabolism, let's quickly see at what sites the various metabolism occur. First, which are the cycles which occur in both the cytoplasm and the mitochondria? So remember, we hug with both the arms. So both is the hug, that is heme synthesis, urea cycle, and the gluconeogenesis. Few points that I want to highlight here. Remember that heme synthesis, H is not HMP pathway. Remember that this is the heme synthesis. HMP shunt occurs in the cytoplasm, so it occurs in the RBCs also. Urea cycle is the next one, and G is gluconeogenesis. It is not glycolysis, it is gluconeogenesis, which occurs in both. Okay. In the mitochondria, we know that mitochondria is related to the oxidation, right? So what do we have is fatty acid oxidation. Which fatty acid? The beta oxidation occurs in mitochondria. Then you have acetyl-CoA production. The TCA cycle after the glycolysis, the TCA cycle, it occurs in the mitochondria. Oxidative phosphorylation, right, ETC coupled. And please remember that ketogenesis also takes place in the mitochondria. Okay, ketogenesis also takes place in the mitochondria. So this is what you need to remember here for the mitochondria. में कौन से आते हैं? Ketogenesis is mitochondria. Glycolysis cytoplasm, RBC depend on glycolysis, HMP shunt. Synthesis of the steroids, basically occurring in the smooth endoplasmic reticulum. Remember, steroids, SESE is the smooth endoplasmic reticulum. Rough endoplasmic reticulum, which has the ribosomes, it is for proteins. Fatty acid synthesis, cholesterol synthesis, nucleotide synthesis, all of that occurs in the cytoplasm. So cytoplasm is a lot about the anabolic reactions, the synthesis occurring, except the ketogenesis. Ketogenesis is not anabolic. Ketogenesis happens when there is starvation. So remember that ketogenesis, acetyl-CoA, this is mitochondria. Okay, this is mitochondria. Okay? Next one, very important and very frequently asked, the ETC inhibitors, complex 1, 2, 3, 4 and 5 inhibitors. So remember that phenobarbital and rotenone 1 and 1, this inhibits the complex 1. Malonate is your T, that is your 2, it is complex 2. Remember that malonate inhibits which enzyme? Succinate dehydrogenase. Always remember, very important, malonate MSD. Malonate inhibits succinate dehydrogenase, not succinate thiokinase. And MSD is a competitive person who always wants to win the match. So remember, MS Dhoni competitive. This is an example of competitive inhibition in the TCA cycle. And succinate dehydrogenase is basically complex 2. Okay, that is complex 2. Now the next one that we have is cyanide, carbon monoxide, azide and hydrogen sulfide. All the IDEs are complex 4 inhibitors, but not carbon dioxide. Remember, but not carbon dioxide. Oligomycin. Oligo means decreasing. So basically oligomycin decreases the flow of protons in the complex 5. Okay, the F0 ATP synthase, complex 5 is where the ATP is getting synthesized. So it is that complex 5. And you have atractyloside. Okay, atractyloside. Remember ATRA, that means it inhibits the ADP-ATP transporter. That is again related to complex 5. The ADP-ATP transporter. Which are the complex 3 inhibitors? Remember, 3 is anthromycin. That is antimycin is anthromycin. Complex 3 is the 3-letter word, that is BAL. Okay, dimercaprol, which is also the BAL, the chelating agent. This is basically complex 3. Anthromycin BAL is complex 3. Okay, is this clear with everyone? The ETC inhibitors. Coming to the inhibitors of the other cycles, most important that we have in glycolysis inhibitor is fluoride. Okay, that is fluoride. So remember that fluoride inhibits which enzyme in the glycolysis? It is enolase. So remember EFG. Enolase is the enzyme inhibited by fluoride, and that is the glycolysis inhibitor. And that is why when we want to measure the blood glucose levels, the vacutainer that we use, glucose G4G is gray color vacutainer that contains fluoride to stop the glycolysis. Okay. The other inhibitors of glycolysis are arsenate and iodoacetate. Okay. Arsenate and iodoacetate are the other ones. इलेक्ट्रॉन ट्रांसपोर्ट के इनहिबिटर्स हम देख चुके हैं, कॉम्प्लेक्स 1, 2, 3, 4 और ये है ऑक्सीडेटिव फॉस्फोराइलेशन वाला एट्रैक्टिलोसाइड, ओलिगोमाइसिन. This is the ADP-ATP transporter. This is the flow of proteins. TCA cycle, most important, which is the competitive inhibition. We just now said malonate and MSD. That is a competitive inhibitor, succinate dehydrogenase. Okay. What does the succinate dehydrogenase form? It forms fumarate. Okay. It forms fumarate. Okay. Next one that we have is fluoroacetate is AC, that is aconitase. Okay, that is aconitase. And arsenite is alpha ketoglutarate dehydrogenase. This is arsenate, this is arsenite. Okay, this is arsenite alpha ketoglutarate dehydrogenase. So one of the questions in the recent NEET PG exams was arsenite inhibits your TCA cycle by causing the depletion of what compound? Basically it is glutamate. Okay, glutamate पे basically act करके जिससे अल्फा कीटोग्लूटरेट बनता है. So remember it is by glutamate. Okay, not arsenite, it is hyperammonemia. Hyperammonemia, the question was hyperammonemia inhibits the TCA cycle by causing depletion of what compound? It is the alpha ketoglutarate, because alpha ketoglutarate requires glutamate to form alpha ketoglutarate, and hyperammonemia में glutamate utilization बढ़ जाता है. Okay, so remember that it is by causing depletion of alpha ketoglutarate, hyperammonemia. Next one is enzyme inhibition के types. Quickly revising, Km increases but the Vmax remains the same. What type of enzyme inhibition is this? Km increases but Vmax remains the same. So this is competitive inhibition. So competitive inhibition, remember when I write competitive inhibition, it is Kmii increasing. That means the Km increases, the Vmax remains the same. Non-competitive inhibition is no Km increasing. The Km does not increase. It is the Vmax which gets affected. Vmax is already maximum, so it cannot go beyond that. So the Vmax will decrease. So in non-competitive, the Vmax decreases. In competitive, the Km increases. And what happens in uncompetitive inhibition? What happens in uncompetitive inhibition? Yes, what happens in uncompetitive inhibition? Very good. Uncompetitive is both going down, under. Under means both going down. The Km also decreases, the Vmax also decreases. Remember, both decreases in uncompetitive. Okay. Now look at the Lineweaver-Burke plots. How will you identify the Lineweaver-Burke plots? Very, very easy tricks to remember are, remember, competitive mein the two lines are crossing. So this is where you see if the two lines are crossing, then it is competitive. Non-competitive, non, when I write N, it is the V that is formed in N, right? It is the V. So when you have V wala, it is non-competitive. When you have the two parallel lines, that is like a U. Parallel lines, when I write U, it has two parallel lines, that is uncompetitive. So easiest to remember, competitive crossed, non-competitive V, and uncompetitive is parallel. And also remember here that which is the inhibitor and which is without the inhibitor. Here the left wala jo line rahega upar ki taraf, that is the one which is the inhibitor. So the red color that you see, this is on the left, this is on the left, this is on the left. The left wala is the inhibitor here. Okay, the left wala is the inhibitor here. Okay. I'll share the annotated PDF on the Telegram group after the class is over. When you get a graph like this, which you also get in pharmacology, which is competitive, which is non-competitive. So remember that this is representing the rate of the reaction, that is the velocity. So Vmax is the same here. The height is the same, the y-axis is the same. Where is the Vmax same? In the competitive inhibitor. So this is the competitive where the height is maintained. In non-competitive, the Vmax decreases, so the graph goes down. Also, you can remember as when you are competing with someone, the competitor, you compete with someone who's at the same level as you, right? So competitor will reach the same level. Non-competitor matlab not in the competition, out of the game, at a very low level. So remember, competition at the same level, and you have a non-competitive going down, not at the same level. Okay, that is how you would remember. So that were the quick tricks on enzyme inhibition. Okay. Now going to the rate limiting enzymes of the various cycles. Which are the various rate limiting enzymes? So for glycolysis, remember it is phosphofructokinase 1, which is the rate limiting enzyme for glycolysis. The kinases are the ones which are the irreversible enzymes in glycolysis. Then ulta for gluconeogenesis, glycolysis ka ulta gluconeogenesis. Phosphofructokinase ka ulta is fructose 1,6 bisphosphatase, right? Breaking down fructose 1,6 bisphosphatase. For TCA cycle or the Crab cycle, remember it is I saw crab in the city. So I saw crab in the city. It is the isocitrate dehydrogenase. Glycogenesis, easy. Glycogen synthase. Glycogenolysis, easy. Lysis wala like lyase, phosphorylase. Okay, phosphorylase. What vitamin does this glycogen phosphorylase require? It is vitamin B6. Okay, it requires vitamin B6. For HMP shunt, as in the last NEET PG exam, HMP is like hum 5 or gunde 6. ठीक है, hum 5 और gunde 6, that is G6PD. G6PD is the rate limiting enzyme. Remember, G6PD deficiency. It is X-linked recessive. It presents with intermittent hemolytic anemia, especially after exposure to fava beans, any oxidative stress, sepsis, antimalarials like primaquine, sulfonamides, they cause G6PD deficiency. Okay. Then you have de novo pyrimidine. Pyrimidine is di. It is CPS2. CPS1 is for urea cycle. When I write urea AAA, it is the first alphabet A. Remember, it is CPS1 for urea. CPS2 is pyrimidine. De novo purine, PR. Purine is PRPP amidotransferase. The glutamine, PRPP amidotransferase. Okay. Fatty acid synthesis. For synthesis, we require a lot of carbons, right? We form fatty acids which are 15 carbon, 17 carbon, 16 carbon. So, बहुत सारे carbon चाहिए, मतलब carboxylase. So, it is acetyl-CoA carboxylase on the backbone. Previous FMG question, what is the backbone for fatty acid synthesis? It is the acetyl-CoA, to which there is carboxylation occurring. Carboxylation requires which vitamin? Carboxylation requires which vitamin? Carboxylation requires vitamin B7, that is biotin. Okay, that requires biotin. Fatty acid oxidation, that is burning the fats. Imagine there's a cat in the hall and you are running behind the cat, burning your fats. So it is cat which is burning the fat, running behind the cat, burning the fat. So carnitine acyltransferase is fatty acid oxidation. Carnitine wala is fatty acid oxidation. Okay, and then you have ketogenesis. Where does the ketogenesis occur? Remember, that is mitochondria. Cholesterol synthesis, fatty acid synthesis, cytoplasm, ketogenesis, mitochondria. Cholesterol synthesis, ketogenesis, have CoA wale enzymes. For cholesterol, it is HMG-CoA reductase, right? Because that is the enzyme which is inhibited by statins. Statins inhibit HMG-CoA reductase. Ketogenesis is HMG-CoA synthase. So you have HMG-CoA reductase for cholesterol, synthase for ketogenesis. Okay. So these are the most important rate limiting enzymes that we should know here. Now, next that we have is CPS1 versus CPS2. What is the difference between two? We said that CPS1 is the urea cycle. CPS2 di is the pyrimidine synthesis. Okay, that is the pyrimidine synthesis. So, CPS1, because it is urea cycle, what will it require? Ammonia is converted to urea, so it requires ammonia. Carbamoyl phosphate synthetase. Carbo means it will require carbon dioxide. So, CO2 plus ammonia. Pyrimidine synthesis wala. Pyrimidine, remember the amino acids required for pyrimidine are GAG is for puri. You remove one G, the G and the A, that is glutamine and aspartate. So, pyrimidine wala is dependent on glutamine, not the direct ammonia, that is CPS2. One is in the mitochondria, two is in the cytoplasm. Nucleotide synthesis was in the cytoplasm. Urea cycle is both cytoplasm plus mitochondria. This one is the mitochondrial. So, urea wala is mitochondrial. Okay, urea wala is mitochondrial. Next one, which are the enzymes active in the fed state versus the fasting state? That is basically you have a lot of questions on insulin glucagon ratio. Okay, this is the indirect, the application of the insulin glucagon ratio. When they tell you that the insulin glucagon ratio is high, that means Is it the fed state or is it the fasting state? High insulin glucagon ratio means the fed state or the fasting state. Yes, absolutely right. When I say high insulin glucagon ratio, insulin is high. That means it is the fed state because insulin comes after the meals. So fed state. And remember that the enzymes which are present in the fed state, that will be the anabolic cycles that will occur. Right? Anabolic cycles. DEF isko ulta pado fed ko, this is dephosphorylated. These are the enzymes which will be active in the dephosphorylated state. Fasting wale, remember fasting, FAS, fasting is phosphorylated state. Okay, fasting wale is phosphorylated state. Okay, so look at this one. Low insulin, high insulin. High insulin means the fed state, that is a dephosphorylated state. Low insulin means the fasting state, that is phosphorylated state. Phosphofructokinase, rate limiting enzyme of glycolysis. Pyruvate dehydrogenase, the link reaction after glycolysis. Glycogen synthesis, fatty acid synthesis, HMG-CoA reductase, cholesterol synthesis. All the anabolic reactions, these are basically in the high insulin state. Remember, even glycolysis produces the ATP. Okay. Next one that we have is opposite in the fasting. Fructose 2,6-bisphosphatase, PEP carboxykinase, pyruvate carboxylase. These are the enzymes of gluconeogenesis, that is catabolic state, right? Fasting में होता है. Glycogen phosphorylase, fasting. Remember hormone sensitive lipase? This is causing lipolysis from the adipose tissue. That means this is the catabolic state. So even this will be activated in the low insulin state. Insulin, high insulin will activate the lipoprotein lipase. Hormone sensitive lipase is inhibited by insulin. Okay, inhibited by insulin. So remember that lipoprotein lipase, that is LIP, this is loves insulin. Okay, so this is when the insulin is high, this will be activated. So once you know that lipoprotein lipase insulin activated, hormone sensitive lipase is insulin inhibited. Okay. Next one that we have are the various enzyme cofactors. Again, a very important and which is tested very frequently in the exam. So let us quickly revise the mnemonics we have seen in the NF100 episodes also. So zinc wala, okay, zinc is carbonic. When I say zinc, it is rhyming with carbonic anhydrase. If it is carbonic anhydrase, then it is carboxypeptidase also. Then zinc is like a gin, which is the alcohol, right? So remember, alcohol wala, gin wala is zinc. So alcohol dehydrogenase, तो lactate dehydrogenase भी है, अल्कोहल है तो alkaline phosphatase भी है और ALA dehydratase भी है. All the AL then come together, है ना? Next one that we have is selenium, right? Selenium, Selena Gomez. You have Gomez is glutathione peroxidase. Then you have, so remember Selena Gomez के beautiful thighs. Thighs मतलब thiol वाले is selenium. So glutathione peroxidase, thioredoxin reductase, thio and io, that is deiodinase. These are basically the enzymes for selenium. Thighs and eyes. Absolutely, you can remember that Selena Gomez के thigh and I is the iodinase वाला. So glutathione peroxidase है. Okay, याद रखना, it is glutathione peroxidase. Next one, copper is coppery. Remember, copper is coppery. That is Y containing enzymes that we have, which is cytosolic superoxide dismutase, tyrosinase, cytochrome C oxidase, and the next we have lysyl oxidase, and we have amino acid oxidase. Remember, amino is Y. So lysyl oxidase is the enzyme deficient in Menkes disease, which is copper deficiency, right? That is copper deficiency. So remember, coppery tyrosinase is copper containing. Next one that we have molybdenum. MO is XO. That is xanthine oxidase. Okay, very very important. है ना? दूसरा क्या है? XO and SO, that is sulfite oxidase, and you have NO, that is nitrogenase, dinitrogenase. So MO is XO, SO and NO, that is xanthine oxidase, sulfite oxidase and dinitrogenase. Iron is succinate dehydrogenase, हमारा favorite enzyme MSD वाला, right? And remember that MSD is competitive and MSD is strong like an iron man. So iron man MSD, succinate dehydrogenase is iron containing. Calcium, जहां पे भी fat होता है, wherever there is fat, there is calcification, right? So fat necrosis में calcification होता है, eggshell calcification होता है, right? So lipase and even a lecithin is a type of fat, है ना? So lecithin is lipase is calcium. Nickel is urease. Nikita's mnemonics give you a eureka moment, right? To remember the difficult topics. So Nikita is eureka. So nickel is urease. Okay. Manganese and magnesium, which sound very similar. So remember, they have similar enzymes also. Hexokinase, phosphofructokinase, enolase and enolase. They have the same enzymes. Okay, they have the same enzymes. So remember that magnesium and manganese. A magnificent man. Imagine a magnificent man going on a kinetic to get eno. Magnificent man going on a kinetic to get eno. This is magnesium, manganese, kinases, the hexokinase, phosphofructokinase and enolase. These are the common ones. Then you have for manganese. Manganese is the remaining one, man ka, manganese ka man. Mitochondrial superoxide dismutase, arginase and nucleotide reductase. Nucleotide reductase, ribonucleotide reductase. Arginase is manganese containing. Magnesium is Mg. So which is the M and the G here? The mutase and the glucose 6-phosphatase, which we have seen is deficient in von Gerkes. Yesterday we saw von Gerkes, right? So remember, it is magnesium containing. So it is mutase and glucose 6-phosphatase. Okay, mutase and glucose 6-phosphatase. So these are the tricks to remember the various enzyme cofactors. Okay. Next one, going to the vitamins K various test. Okay, what are the various tests for the various vitamins? Okay. Next one, what you have, B1, thymine. For that, very very important, the test is transketolase, RBC transketolase. So B1 की deficiency में क्या होगा? Okay. B1 की deficiency में क्या होगा? Very very important, that is given is one is Wernicke's encephalopathy. Okay, Wernicke's encephalopathy, and Wernicke's encephalopathy, the triad given is Goa. Okay, triad given is Goa. That is global confusion, ophthalmoplegia and ataxia, and the patient is an alcoholic patient. And they tell you that which of the following tests will you do in this patient? It is RBC transketolase, that is for B1. Okay, that's for B1. Next that you have is B2, riboflavin, flavin FAD वाला, उसमें करते हैं RBC glutathione reductase. Okay, glutathione reductase is for B2. Okay, that is for B2. Next one for B6 pyridoxine, it is RBC transaminase. So remember 6 number का transaminase, 6 number का transgender है ना. So remember transaminase is B6. Transamination के लिए we require vitamin B6. Very very important. Very very important. Tell me what does alanine form on transamination? What does alanine form on transamination? Alanine on transamination forms, yes, Very good. It is pyruvate. Okay, it is pyruvate. So that's the reason you have that enzyme ALT, which is also called as SDPT, because Al is the alanine and it forms the pyruvate. Similarly, AST is called as SDOT. Why? Because AS, that is aspartate, forms oxaloacetate. Okay, aspartate forms oxaloacetate. Okay, so remember that aspartate forms oxaloacetate and alanine forms pyruvate. Glutamate forms alpha ketoglutarate. This requires vitamin B6. Then for folic acid, F for F, we have the Figlu excretion or the histidine load test. So you have for folic acid FGH, Figlu, and we have the histidine load test, which is for folic acid. Folic acid, remember, is the one carbon carrier, compound carrier in the body. Vitamin B12, cobalamin, we have seen it is methylcobalamin. So it is the methyl malonate levels that will be tested for B12. MMA levels increase with B12 deficiency, right? Very, very important for the exam, the differentiation of folate deficiency versus B12 deficiency. Frequently tested. Both of them will have megaloblastic anemia because both of them required for DNA synthesis. So there will be hypersegmented neutrophils. But B9 is the deficiency of the leafy vegetables. Okay, foliate मतलब leaf, तो leafy vegetables नहीं है. B12 will be seen in vegetarians. There will be B12 deficiency. B12 deficiency will have neurologic manifestations also. Both of them will have increased homocysteine, but B12 will also have increased methyl malonic acid. It will also have increased methyl malonic acid. So in B12 you also get because of the neurologic complaints, the subacute combined degeneration of the cord. SACD is what will be seen with vitamin B12 deficiency. So when you have a patient with vitamin B12 deficiency, don't give B9 alone, because it will worsen the neurologic symptoms in the patient. Anemia तो ठीक हो जाएगा, लेकिन neurologic symptoms worsen हो जाएंगे, right? So with B12 deficiency, only B9 should not be given. So these are the various tests that we have for the various vitamins. And now going to this one, this is a reaction which is showing how Figlu excretion test is done for folate. So histidine basically forms, you see it forms the Figlu by the various reactions, and then this tetrahydrofolate reacting with Figlu, and then what you get is the other compound और glutamate बनता है, ठीक है, और glutamate बनता है. So when there is no folic acid, Figlu accumulates and the Figlu is excreted in the urine. Okay, so Figlu excretion test is used in folate deficiency. Next one, what do we have is in which vitamin deficiency? Okay, in which vitamin deficiency do you get increased zinc urinic acid levels? In which vitamin deficiency zinc urinic acid levels are increased? No, Megha, this is the last class, I suppose. If there's anything else you need from biochemistry, let me know. We'll do it another session. We'll try to do that. Remember, this is pyridoxine. Kyunki what you are saying here, ki B6 is required in this tryptophan metabolism to convert this kynurenine into anthanilic acid. No need to go into that details. Just remember that B6 का अगर deficiency होगा तो zinc urinic acid बढ़ जाएगा, right? And you are also seeing that this is the pathway which is forming niacin from tryptophan. Tryptophan forms vitamin B3 and that requires vitamin B6. And that is why B6 deficiency can also lead to B3 deficiency. So which vitamin deficiency can cause B3 deficiency? It is B6 deficiency. Okay, B6 deficiency. Next one, look at these very important images that you are seeing here. What are these images showing? First one is acrodermatitis enteropathica. Okay, acrodermatitis. Acro means the distal limbs, and this is acrodermatitis enteropathica. Perioral, perianal hands are involved. This is because of deficiency of zinc. A very, very important question for the exam. Okay. Then you have the next one, which is the Casal's necklace, the dermatitis. Very important again. Casal's necklace is vitamin B3. Necklace is niacin. Okay, necklace is niacin. Okay. So this is B3 deficiency. And remember that B3 का toxicity भी हो सकता है. What do you see in niacin toxicity? There is flushing. Flushing is a feature with B3 toxicity. It is hepatotoxic. AST, ALT levels will increase, and it can cause macular edema as well. Okay, it can cause macular edema as well. The next image is showing bitter spot, which is seen with vitamin A deficiency. Also with vitamin A deficiency, remember phrinoderma. Okay, remember phrinoderma also with vitamin A deficiency. Tell me, in which vitamin deficiency do you see hemolytic anemia? In which vitamin deficiency do you see hemolytic anemia? Very good. It is vitamin E. Remember, vitamin E, erythrocytes are affected. Erythrocytes get lyse, hemolytic anemia. Do not confuse with hemorrhagic disease of the newborn. Hemorrhagic disease of the newborn is vitamin K. That is why in a newborn we give vitamin K ka injection, because vitamin K can be formed in the gut but not in the sterile gut, right? It requires those bacteria. So hemolytic anemia is vitamin E. Next one that you have, in which one do you have collagen which is defective? C for C, collagen is vitamin C, and that is why there will be delayed wound healing. Okay, that is why there will be delayed wound healing in vitamin C deficiency. There would be bleeding gums, scurvy manifestations, perifollicular hemorrhages is what we would see. In which vitamin deficiency do you get corneal neovascularization? Corneal neovascularization is B2 deficiency. Remember, B2 is ribo. Ribo is rubro, ribo is SIBO. Rubro matlab red color ke vessels. SIBO means there is seborrheic dermatitis also. You can get the image of seborrheic dermatitis also. So B2 is corneal neovascularization, seborrheic dermatitis, cheilosis, glossitis is what you get. Okay? In which one do you get the burning feet? In which one do you get the burning feet? Feet may we wear the pants. Right, so remember it is pantothenic acid. Panto is vitamin B5. Panto means 5, and this is required for, this is coenzyme A. Pantothenic acid is coenzyme A. Okay. That is what we see here in the various enzyme deficiencies. If you eat the raw egg white, it leads to deficiency of which vitamin? It is vitamin B7 because of the avidin. Okay, because of the avidin, biotin deficiency is what we see. Biotin deficiency. Okay. Going on to the next one now. Okay. Coming to the next one, that is lipoproteins. Okay, lipoproteins. So which one has maximum triglyceride content? Which lipoprotein has maximum triglyceride content? It will depend on whether it is exogenous triglyceride, endogenous triglyceride. Exogenous मतलब बाहर से आने वाला, diet से आने वाला is chylomicrons. Endogenous is liver में बनने वाला. The first to be formed in the liver is VLDL. Then comes the IDL and the LDL, right? So first is the VLDL. Overall maximum is chylomicrons, 98% triacylglycerol. So overall is chylomicrons. Phospholipid is maximum in? Phospholipid is a good part. So HDL, H for healthy. The healthy wala is the one which has the maximum phospholipids. Okay, it is the one which is the maximum phospholipids. So when you do lipids ka electrophoresis, which is the one which goes sabse dur? सबसे दूर कौन सा जाता है? Right, the healthy is the one which can run fast. Okay, so remember that anode के पास जाने वाला, we start the electrophoresis from cathode to anode. So anode के पास जाता है alpha lipoprotein, A for A. Alpha lipoprotein is HDL. Cathode के पास रहता है C for C, that is the chylomicrons. So chylomicrons sit at the origin. HDL is the one which goes सबसे दूर. Okay, which goes सबसे दूर. This is about the composition of the lipoproteins. Coming to apolipoprotein. What is the apolipoprotein for chylomicron? Right, for chylomicron, it is ApoB48. Okay, it is ApoB48. For LDL, it is B100. So remember, micron is the one which is a micro number less than 148. This is chylomicron. LDL is 100, B100. Chylomicron remnant has ApoE. Okay, ApoE. And HDL, alpha lipoprotein, A1 number का lipid, it is A1. ApoA1 is the most important. Okay, ApoA1 is the most important for HDL. HDL is the one which causes the reverse cholesterol transport. From the tissues to the liver, it causes the reverse cholesterol transport, and this requires LCAT. Okay, and this requires LCAT. ठीक है? So these are the ones that are very important, and remember that lipoprotein lipase is activated by which apoprotein? Lipoprotein lipase is activated by which apoprotein? It is ApoC2. Okay, it is ApoC2. And lipoprotein lipase deficiency or ApoC2 deficiency leads to which dyslipidemia? In the Friedrichs classification, dyslipidemia type what? Type 1, type 2, type 3, 4, 5. What dyslipidemia it is? Right, it is dyslipidemia type 1 where you have hyperchylomicronemia. ठीक है? So chylomicrons blood में बहुत ज़्यादा होंगे. They will not be able to be lysed because it requires lipoprotein lipase. Remember yesterday we have seen it cleaves the chylomicrons and the VLDL, right? So the deficiency of that will lead to increased chylomicrons. Whenever the increased chylomicrons is increased triglycerides, it will give a milky plasma. Okay, that will give lactescent or milky plasma. Increased pancreatitis risk is what we would see. Okay, if you are given a patient with a xanthoma in the Achilles tendon xanthoma है अगर, तो फिर कौन सा dyslipidemia है? So tendon xanthomas is, tendon is 2, right? Tendon, remember is tendon is do, that means type 2. Type 2 is hypercholesterolemia where the LDL receptor is defective. Okay, the LDL receptor which is responsible for taking in the LDL is defective. So remember that tendon xanthoma is in do, that is type 2, which is familial hypercholesterolemia. What is the inheritance pattern of familial hypercholesterolemia? Familial disorders are autosomal dominant, right? And the chromosome number is 19. Okay, the chromosome number is 19. ठीक है? That is what you need to remember here. And remnant वाला is type 3. Remnant जिसको E लगता है उसको उल्टा कर दो. That is type 3 dyslipidemia. That is called as broad beta dyslipidemia. That is type 3 remnant वाला. All right. Going on to the next one, that is the blotting techniques. We know the trick, that is snow drop. Okay, the trick is the snow drop. Southern blotting DNA, northern blotting RNA, western blotting is for proteins. Okay, western blotting is for proteins. So what do we have is southwestern blotting. South is for DNA, west is for proteins. So it is for DNA protein interactions. DNA protein interactions. And what do we have in the eastern blotting technique? What is the Eastern blot for? Eastern blot is the post-translational modification in the proteins. Okay, the post-translational modification in the proteins is basically the Eastern blotting. Okay, that is the Eastern blotting. So remember, Western blot, snowdrop, that is for proteins. Western is for proteins, Western blot. So this protein involves the antibodies also. So indirectly when they tell you कि SLE का patient है, हमको antibodies देखना है, तो हम करेंगे वेस्टर्न ब्लॉटिंग. HIV का पेशेंट है, एंटीबॉडीज देखना है, हम करेंगे वेस्टर्न ब्लॉटिंग. ठीक है. इफ द क्वेश्चन इज कि फॉर जीन फंक्शन व्हाट ब्लॉटिंग टेक्निक विल यू डू फॉर द जीन फंक्शन? Southern blotting, northern blotting, western blotting, what will you do? What blotting technique will you do for the gene function? Right. Remember, for gene function, it is the northern blotting because gene function कर रहा है कि नहीं. What is the function of a gene? Gene मतलब DNA. DNA का function है to make RNA by transcription. DNA forms RNA by transcription. So whether the gene is functional or not functional, you will get to know by the product, the analysis of the product, and the product of the gene is the RNA. Okay, RNA is the product. So by knowing the product, then we will get to know whether the gene is functional or not. Okay, so that is why remember that it is the northern blotting for the gene function. Right. Going on to the next one, the bacterial DNA polymerase. DNA polymerase 1, 2, 3. So remember that these 1, 2, 3, they represent the ranks in the exam. Let's say that 3 is the bottom rank, lowermost rank, 1 is the topmost rank. So 1, 2, 3, all the students appearing for the exam basically do proofreading. Right, when you give a grand test, everybody does proofreading of कि सब questions answer किए हैं कि नहीं किए हैं. Right, that is a proofreading. So everybody does that. So 1, 2, 3, do the proofreading. Next, if you fix that error, right, if you fix that error, then it is DNA polymerase type 1 and 2. So going back to this list here, what do we have is proofreading activity is with all the 3. Repairing the error, fixing the error is polymerase 1 and 2. Right. So अगर आपने error fix किया, while proofreading you found that, oh, I marked this as the wrong answer, let me correct that, then it gives you the top 2 ranks. But then, when do you get the rank 1? When after the grand test you realize that these are the areas where I am lagging, I need to fill the gaps there, then it gives the rank 1. So remember that fills the gap in the lagging strand is the polymerase 1. So if you want first rank, you will have to fill the gap wherever you are lagging. So remember, gap filling is the polymerase 1. Okay. And which is the DNA polymerase which keeps on synthesizing new DNA all the time? It is like the student getting the lowermost rank who's trying to read everything, synthesizing new material in the brains all the time. So remember that the DNA polymerase with the highest rate of chain elongation, that is most processive 3, replication हमेशा करना है, is DNA polymerase 3, polymerizes Okazaki fragments polymerase 3, synthesizes leading strand is also polymerase 3. So polymerase 3 is all the time looking at synthesizing the new DNA, the chain elongation, the replication, be it the Okazaki or be it the leading strand. Okay, so remember that these are the ranks 3, 2, 1. 1, 2, 3, proofreading all of them. 1, 2, fix the error, repairing. 1 fills the gap, and 3 is the one who synthesizes all the new DNA all the time. Okay. So coming to now the eukaryotic DNA polymerase, which are labeled as alpha, beta, gamma, delta, and epsilon. Okay, alpha, beta, gamma, delta, and epsilon. Fill it like a circle like this. Start with alpha. That is the first DNA polymerase. For the DNA synthesis, the first thing that we require is the primer, right? So RNA primer is required. So we have primase. Alpha is the one which contains primase, initiates the DNA synthesis. फिर आएगा आपको एंटी क्लॉकवाइज जाना है, क्लॉकवाइज नहीं। अल्फा के बाद एप्सिलॉन इज द लीडिंग स्ट्रैंड, ओके, सो एप्सिलॉन elongates the leading strand, delta is the lagging strand, delta is the lagging strand. Next is the gamma, ma, mitochondrial DNA, which comes from the ma, that is the mother, maternal inheritance, it is gamma. So gamma is the mitochondrial DNA. अभी सब DNA synthesize हो गए, leading strand, lagging strand, mitochondrial DNA, then remains the repair. So repair is the main function of polymerase beta. Okay, polymerase beta is the main repair wala enzyme in the eukaryotic DNA. Okay, in the eukaryotic DNA. Is this clear with everyone? So in the eukaryotic DNA, which does the gap filling on the lagging strand? Leading wala jo synthesize karta hai, that is epsilon. Epsilon does the gap filling in the eukaryotic DNA. ठीक है? Clear with everyone? So remember that alpha, beta, gamma, delta, epsilon. Alpha initiates primase, leading, lagging, mitochondrial, and this is the repair. Okay, this is the repair. And epsilon is the one which is gap filling. Epsilon is the gap filling. Okay. So that's over, and I didn't realize that. So this completes the part 2 of the biochemistry revision. Just to add on few points that I remember. So remember that galactosemia, okay, few important errors, inborn errors of metabolism. Galactosemia, the history that would be given is the cataract. It leads to oil drop cataract. What is the enzyme deficient? What is the enzyme deficient in galactosemia? Remember it is Galliput. I remember it as Galliput, that is galactose 1-phosphate. It is not galactose 6-phosphate. Okay, it is not galactose 6-phosphate. It is galactose 1-phosphate uridyl transferase. Coming to fructose wala, where you have essential fructose urea and where we have hereditary fructose intolerance. Okay, so essential fructose urea is the enzyme fructokinase. Essential matlab it's asymptomatic, not causing much of the trouble to the patient. Hereditary fructose intolerance is the aldolase. Aldolase B is the enzyme deficient here. Here the patient will have failure to thrive vagera. So fructose is present in the fruit. Fructose is fruit. So there will be the history of jab the infant is given fruit juice, then the symptoms start. Okay, so weaning time fruit juice there hai, tab symptoms aa rahe hain. That is the clue for fructose intolerance, and that is aldolase B. Okay, and that one is aldolase B. Okay, so remember these enzymes also. The rest of them disorders we have seen. Porphyria में एक वाला जो याद रखना, acute intermittent porphyria has only neuropsychiatric features, the visceral features. Remember, it does not have cutaneous manifestations. There is no photosensitivity in acute intermittent porphyria. And what is the enzyme deficient in acute intermittent porphyria? I is for 1. Remember that it is uroporphyrinogen 1 synthase, not 3 synthase, which is also called as PIH, uroporphyrinogen 1 synthase, PBG deaminase, and HMB synthase, hydroxymethylbilane synthase. PIH are the 3 alternative names for the enzyme deficient in AIP. And remember that what is the inheritance pattern of AIP? AIP is autosomal dominant. Autosomal dominant. Which one is autosomal recessive? Which porphyria are autosomal recessive? Remember, AR is ER. So erythropoietic wale jo hai, right? Congenital erythropoietic porphyria, erythropoietic protoporphyria, right? These are autosomal recessive. And also the ALA dehydratase wala is autosomal recessive. Erythropoietic will have only photosensitivity. Okay, erythropoietic will have only photosensitivity. Okay, so yes, that is about biochemistry part 2. I have tried to include quite a few things about biochemistry. This is like the core, but remember that this is not enough. So if anybody has that query, is this enough? Remember that This is the core. This is not like enough. Lakshay, which rapid revision of biochemistry? Are you talking about the dedicated plus course of biochemistry? I have taken off 10 hours. It has more information than this. Okay. All right. So when do we have the next class? We have the next KBMD, that is the quiz, the live test and discussion tomorrow at 6 p.m. on the Unacademy app, where we will discuss the preclinical subjects in the clinical way. Right, so basically pre-paraclinical subjects, anat, physio, biochemistry, pharmac, micro. We will put some interesting clinical questions. So important for the students appearing for upcoming next as well. Okay? Thank you so much everyone. Goodbye. Take care. And I hope biochemistry is not that difficult now. Do try to concise biochemistry from USMLE first aid book. It's really given very well in that book. Okay? Thank you. Goodbye. Take care and keep studying. Keep revising.